Guess what? Welcome to another program of Focus on Health. Now, I always give a teaser, but y'all are so smart. Y'all always catch on to this one. But I've never had these professionals on. This is the first time. So this is a treat for you all. It's a treat for me, too. I'm not going to give you all no more information because you're all just too smart and you all always guess. But I'll see you on the other end of this commercial.
Man, I wish the city would fix these darn potholes. Someone needs to report this.
Has this ever happened to you and you didn't know who to call? It's simple. Dial 311 or 706-653-4000. Columbus 311 Citizen Service Center. Our goal is to provide complete, accurate, and timely information to citizens and employees regarding complaints, inquiries, and requests for information. Columbus 311 Citizen Service Center, your direct link to city service.
Welcome back to Focus on Health. Guess what? I have to my right, I'm going to have them introduce themselves, take about a minute, talk about their very prestigious background, and then we're going to kick off the program. So I'm going to start right here to my right, and then she can introduce herself, and then she will pass the baton to the next guest. Two good guests, and here's a tease. They share something common with me. So, Pam.
Thank you, Pop, so much for having us, and we appreciate the opportunity to come on your show. I'm Dr. Pamela Shaw Grant. I am a family nurse practitioner, and I've been a nurse practitioner for about 27 years. And also, our basic degree is a registered nurse, so I've been that for over 40 years. So I've been in the Columbus area for a while working. I've worked at various settings. I've worked family practice, emergency room, at the State Psychiatric Hospital, and I currently work with New Horizons Behavioral Health here in Columbus. I manage the integrative health program there. I do mental health, physical health, and I also am the provider that writes Suboxone, buprenorphine for medication-assisted treatment. So those are the things that I do.
And our delighted other guests, and we share something in common, so what it is, I'm a nurse too. These are nurse practitioners though. That's the difference.
My name is Dr. Chandler Padgett, and I'm a family nurse practitioner by trade. I obtained my Bachelor's of Science in Nursing degree from Columbus State University, as well as my Master's in Science of Nursing degree or Family Nurse Practitioner degree from Columbus State University as well. I'm so grateful to have obtained my Doctor of Nursing Practice degree from Georgia State University. I currently teach as an assistant professor at Columbus State University in the Master's program or the FNP program, again, Family Nurse Practitioner program. And I also work as a nurse practitioner as a certified injector at Studio Aesthetics in Columbus, Georgia.
So you see, my guests are eminently qualified. They're eminently qualified, and so I'm so glad to have them. And being a nurse, I'm really honored. And you know, they say you never get too old to go to school, and plus I'm at the elite age, and I had contemplated that, where I could go and the Regents say I don't have to pay any of that jingling, so I might be coming in y'all's way there. Okay, so we're going to talk about nurse practitioners, and the reason I want this to happen is because you know, nurse practitioners, a lot of people don't really realize the scope of nurse practitioners and what a blessing nurse practitioners are in the community, in the Columbus community, and also in the outlying communities where there are hardly any service. They're a real blessing. And so what I'm going to do is I'm going to hand it over to them, and they're going to say when they advance the slides, and we're just going to let you know on how valuable nurse practitioners are. And so, Pam, I'm going to pass it over to you guys, and I'm going to sit back here and just relax and listen to what I already know, and just rest in the fact that y'all are really getting to realize all that nurse practitioners do and how valuable they are. And so it's in your hands now, Pam.
Thank you so much. So initially what I want to discuss is what is a nurse practitioner, just to educate the public. We, of course, as we've said, are registered nurses. We have to have a 4-year bachelor's degree. And then we've worked in the field, we've worked in the hospitals. And then we go back to school to get that master's in nursing. And then that's where you get either your family nurse practitioner, and then now there are a lot of other options: psychiatric nurse practitioner, acute nurse practitioner, there's a pediatric nurse practitioner. There are a variety of fields that you can specialize in. And then, of course, your doctorate. And Chandler and I, we both have our doctorate in nursing practice. And each of those degrees, the family nurse practitioner and doctor, take an additional 2 years each. And
Okay, so
then-
let's go to the first slide. And
Okay.
That slide pretty much sums up what you're saying.
Okay.
That first slide. And then you want to go to the next slide?
And then next slide. So where do we work? What do we serve? As I stated previously, I work at a community mental health in Columbus, so I work with mental health. I also work part-time at the jail, so we work in corrections. I've worked family practice. I've worked emergency room. We work in hospitals such as intensivists that you see now at the hospital. When you go to the hospital, you may not see your own primary care doctor, but you may see a nurse practitioner caring for you while you're in the hospital.
So in other words, nurse practitioners cover the lifespan, just like the whole lifespan, just like physicians do.
Exactly.
Okay.
From birth to gerontology ages.
And so you perform what, physical exams and order labs,
We do.
diagnostic tests, prescribe medications, and develop treatment plans
Yes.
treating acute and chronic illnesses, just as physicians do.
Yes, we do. We can prescribe medications, and those are some of the things that we want to work on to expand our scope. But we can prescribe medications, we can assess and diagnose you, and we can do your physical exam.
That's
and of
awesome.
course, treat you holistically, the whole body and mind.
And that's very important, that last term that you said, be able to treat the patients in a holistic manner. And one of the things I can talk about just from going to nurse practitioners is the fact that they, in a holistic manner, they find out about your lifestyle, what you're doing. Not saying physicians don't, but it's an altogether different focus that nurse. You want to talk a little bit about that?
Yes, we do. We take the whole patient or person into a perspective where we talk about, when we do that initial visit, what's going on with their physical health and their mental health. What's going on with their families.
Right.
I invite the families in as well with our visits so we can just get a whole picture of what's going on and how can we help that individual.
Okay, you want to go to the next slide?
So the next slide, we'd like to discuss just what do we have within the state of Georgia here. So for registered nurses, there are nearly 99,700 here. So that's a powerful voice. Nurse practitioners, we have about 11,000 here in the state of Georgia. And then also under our umbrella are the certified registered nurse anesthetists. Those are the people in the surgery suites that's helping to put you to sleep for your surgery. And there are like 1,400 of those. And then we have certified midwives. And those are the ladies or gentlemen that help you with delivery. And they work in your OBGYN offices, and there are nearly 450 nurse midwives here in the state of Georgia.
All right, next slide.
And then we're going to get Chandler to talk to us about what we're doing here in the state and what we'd like to see.
All righty.
So we are so grateful to be here today with you, Pops, and to be able to educate on 2 House bills that will be proposed this session. So we are so excited to speak on these. One will be House Bill 215, or HB 215, and this will help APRNs obtain a license to practice if passed. So you might be asking yourself, if you're asking for a license to practice, what do you currently practice with? So currently what we have is an authorization to practice. But what we would love to see happen, and for this bill to be passed, to obtain a license to practice. The other bill we'll also speak on is House Bill 214, or HB 214. And what this bill does is will allow APRNs as well as PAs the ability to write for handicap vehicle decals. Where currently physicians are able to do this, but this will allow APRNs and PAs in the state of Georgia to have this ability as well.
And I'd like to comment on being someone who's handicapped myself. I'm just going to give a scenario. As things play now, let's say I'm a nurse practitioner and you come to me. I can do the assessment. I first of all, as Pam said, get to know you and know about you, what limitations you have that may impact your daily life. I do the physical assessment, that's done, and then I fill out all the paperwork. What I've got to do next, and you all step in if I'm wrong, I've got to send that paperwork to a physician, for a physician to look it over and authenticate. Well, you know how Murphy's Law plays. You've done bureaucracy, you know how things can just lay around there, and it may lay on a physician's desk weeks, maybe a month. That impacts directly a patient's life. What this is asking is for the nurse practitioner who's doing the assessment, knowing the person and everything, to be able to fill out the paperwork under his or her own authority and send it. So it's not a competition thing. Everything that's focusing here is focused for the patients. That's one. The second bill, that if I'm driving and this is common sense. My grandmother's the smartest person in the world. If I'm driving a car and I go through the motor V and they give me my license to be able to drive, like anyone else, if a plumber goes to or auto mechanic goes through a CDL verification to drive a truck, if they pass the test, give them their license. I just can't see the connection why nurse practitioners cannot have a license of their own if they go through all that schooling, 4 years of nursing school, 2 years beyond that of master's and other certifications. Why can't they have their licenses do them? And so I want to dispel a concept here that some people may have. There's no competition with doctors. Nurse practitioners are a blessing to the community in assisting in health care. And that's the primary thing. So they should have their own license. And for someone like myself who has to ambulate with a cane, once they do their assessment and they fill out the paperwork, I should be able to get my handicap decal. So they're basically breaking it down. That's exactly what they're asking about. And I asked them to come on so that you, the viewers, who we all serve here and love serving as nurses, will just know some of the things that concern us.
Exactly. And so what it will do is decrease that delay in care. And that's what we care about. We want to help our patients.
Yeah, it's patient focused. It's being patient focused.
Yes.
Serving you. And we were just having a sidebar conversation before we came on. You know, as nurses, you have to love people. And you have to be a selfless type of person that really doesn't mind doing things for people, really love people. So these two things gives nurse practitioners with their own license just more flexibility to assist and help you. And as far as the handicap decal, I might need to come you all to do an assessment of me to give me so I can have some other things that I can use to get around. I don't want any delay. So okay, Pam, let me stop, let you all get back to the program.
And so we just want people to know that what we do also in the community, we have a local organization here with nurse practitioners and advanced practice nurses. And what we like to do here in the community is give. And we've done health fairs. We come to the local shelters, the homeless shelters. We've done, when Ralston Towers were open, we did health fairs for them. And so we're willing to do that for the Columbus community.
And now you also have some dates. February the 23rd, being at the Capitol. You want to speak about that?
Yes, sir. So we're so grateful to be able to be here with you today, and we're really hoping at this point that you're feeling that pull on your heart to be present. We're so grateful again to be able to advocate about these upcoming bills and hopes that you'll be able to see that our main goal is to expand our scope of practice as APRNs to help ensure health equity. So if you're having that pull on your heart today, we would love to highlight some opportunities for you to become more involved. So one of these involvements would be Georgia Commission on Women is hosting a day at the Georgia Capitol. This will be February 23rd, again at the Georgia State Capitol from 1 p.m. to 3 p.m. and this is the Champions for Change Day, where they're going to be highlighting and awarding 6 individuals who have been champions for change. So whether you're a registered nurse, an APRN, an advanced practice registered nurse, or just a citizen who wants to show your support, please come to the state capitol that day.
That's awesome. And then you have another date also.
That's right. So there's another day, which is also at the Georgia State Capitol. Now this will be placed through Georgia Nurses Association, and this is the 2023 Georgia Nurses Day at the Capitol. This is an amazing event where legislators will speak, and Georgia nurses from around the state of Georgia can come, mingle, network, and support bills that will be placed this session as well. And this will be on Thursday, March 16th from 8 a.m. to 12 p.m. at the Georgia Freight Depot, again at the state capitol.
And so this is just marvelous, and I'm going to welcome them back again. I just wanted to, many people ask, what do nurse practitioners do? What do PAs do? And the whole community, the whole health care scheme, physicians and nurse practitioners, PAs, we're all work for y'all to maintain your health so that you can live as long as you can, as well as you can with your loved ones. No competitions, but nurse practitioners, more people need to know that their scope of what's called scope of practice needs to be increased. They need their own license so that they won't be encumbered. It's only fair for them to have their own license. And then secondly, for individuals like myself, who they can assess and they can see the limitations that we really need, we should not have a delay. No competition between the various professionals. We all work in unison for YOU. And so now what I would like for my guests to do is to look into that camera and to let my viewing audience know how they can contact each of you individually. So you look in there, let them know your phone number, your email address, and your brick and mortar, how they can get in touch with you. Look into that camera right there.
So, like I said, I'm Dr. Pamela Shaw Grant. You can contact me at 706-464-7745. My email is P as in Paul, G as in George, Shaw, SHAW, 19, pgshaw19 at gmail.com. And I'm also working at 2nd Avenue. I work at the New Horizons Behavioral Health Building, and that's 1328 2nd Avenue.
Your next up.
And my name is Dr. Chandler Paget. You may contact me at 706-392-7690. And my email address is padgett_Chandler, CHANDLER, at columbusstate.edu. And I do want to do a disclaimer that I'm not here on behalf of Columbus State. I'm here to help advocate for APRNs.
Right, but you want to know something? I am here. I am a nurse, and I sincerely, from a nursing perspective, I sincerely appreciate what everyone, physicians, nurses, nurse practitioners, PA, do, not only for me, and I've had some issues, but also for you in the community. Being out, an elected official, being out in the community, speaking to people, I do know that we need healthcare professionals because each of you is someone's loved one. I'm speaking to each one here. You're someone's loved one. And so until next time, I want you to be good to yourself. You know why? Because God loves you. Bye-bye now.